Okay, great.
So
And
welcome,
Randy, take us
everyone.
away.
I think most of you already know Kidsave, but for those who are new to us, just wanted to give you a very short background on who we are and what we do. Kidsave is in its 25th year, and for those 25 years, we have worked to change the lives and the outlook for thousands of older children that are growing up in government care, both in the US and around the world. As I mentioned earlier, we've got a group of Ukrainians in with us this week. We bring people in to train them on our models, and then we also, of course, do work here. Um, our models, something that helps older kids. We really focus on children who are 9 to 18 who are living in foster care or sometimes in orphanages and shelters. And we work to find them lasting connections to caring adults as well as permanent adoptive families. The Weekend Miracles program here in the US and the program that Embrace is most closely associated with connects children, older children in foster care in the US with families. And it also gives these kids a very important addition, which is a voice and a choice and who they get to know, who they get to spend time with, and who might ultimately become their lifelong mentor or their adoptive family. Internationally, we support children through a program called Summer Miracles, which is very similar, bringing kids back in the community where they get to meet and get to know families. And that we're working for hosting and adoption, bringing kids into the United States. In Ukraine, we focus heavily on humanitarian aid when the war started, but we are more and more working with the Ukrainian government to develop programs to place Ukrainian children into families. And it's, of course, critical there because so many children have lost their families due to the conflict with Russia. So we are working side by side with the Ukrainian government to bring family placement programs to Ukraine and to help train their people to be able to bring these kids in the communities where families can meet them. In Sierra Leone, we currently are working primarily on kinship and community placement that for children that were affected by Ebola and the genocide. Embrace was a project that we created with a wonderful task force that I know Shantae will tell you about, really aimed at improving permanency outcomes for Black children in care. Uh, we were concerned over the 25 years that we've been working in this area that the outcomes for Black children in care are worse than any other group. And so we really wanted to do something that we could to both help for Kidsave's own programs, but also to be able to provide something that would expand the literature and that would give other groups that were working to place all children, but particularly Black children, the evidence that they could have to go to their constituents, to go to their governments, to go to their communities as to why they needed to do something more to improve these outcomes. So as the first step, Kidsave created an evidence-based study to understand the barriers for families, particularly Black families, to mentor, foster, and adopt. And we're very grateful that Dave Thomas Foundation stepped up to provide us with the core seed funding to get that project going. The Leslie Alexander Foundation came in and provided additional funding, as did the Hilton Foundation, which allowed us to be able to do this study that talked about things that many of us in child welfare are already aware of, but that we never had the quantitative data to be able to say, this is why people are having barriers. And these are some of the things that could be done to improve the outcomes. So with that, I think I'm turning this over to the indomitable Shantae Armstrong, who has been leading the Embrace project really since its inception, and she'll take us through what's happened since our first year of launch.
Thank you, Randy. And I do want to say, thank you everybody for showing up and being here today and spending an hour of your Wednesday with us in community, despite or in spite of what's happening in our world. I think it's really important that we come together, and continue the work. We made sure that we gave like an extra week to kind of figure out after last week, like what's happening, whatever's going on with you, we're still here, right? And so we're here to, one, focus on Black families and supporting youth and how we can continue that work. And so we'll review a little bit of the disproportionality that impacts Black youth in care. And like Randy says, the Embrace Project has been focused on specifically improving outcomes for Black youth in foster care. But we'll talk a little bit more about how we're expanding on that as well. And we'll hear from a former Black youth in foster care who's also on our Embrace Task Force and talk about what we've been doing this year, which is partially the key findings of the research that Randy mentioned. So we worked with Gallup to create a large national study so that we could use data as a catalyst for change. But we've done other research since then from that study that we're going to share with you today. And then we'll talk about, based on that research, what we decided to do and recommend moving forward. So quick review, probably, many people here already know that Black children are overrepresented in foster care and underrepresented in adoption, as well as experience multiple placements, higher removals, and less likely to be reunited with their birth families. So that's why we're here today. That's why Embrace was created. And that's what we've been working on. So the ways that we're working on that is by, telling stories from children, Black children, telling stories from Black families and communities, centering youth perspectives and centering family perspectives, so that we can make real change. So the data is really here not to just have the data that many of us know that this is an ongoing crisis, but so that we can take it and share with legislators and share with policymakers and share with people who may not know what's going on, right? And have that physical data and say, like, these are real people's experiences as well as here are numbers. Let's do something about this in an ongoing way. So with that, I would like to introduce Erica Thomas, who is a former youth in foster care. She is one of the first BIPOC judges nationally, and she has, been an important success story for us as well as I think just for herself. Give me a second. I'm going to stop sharing and tell you a little bit about her. And then I'm going to pass it over to you, Erica. So let me read her bio. Her bio is very long, but I'm just going to share a little bit with you for now. The Honorable Erica Thomas is a trailblazer, one of the youngest individuals to have membership in any state's legislative body, and one of the first orphans to hold political office. She's a versatile leader serving in many capacities as a television and film producer, author, speaker, mentor, philanthropist, political consultant, nationally renowned foster care advocate, and former Georgia State Representative, representing Georgia's 39th House District in Cobb County. Beyond her accomplishments, she is most dedicated to family. She is the proud wife to her husband, OJ, and mother to their 2 daughters. Erica often references Dr. Maya Angelou's quote, "I come as one, but I stand as 10,000," as a motto in dedicating her life to advocacy for children in foster care, standing with and for children in the foster care system as an example of all they are and can become. Erica, I'll pass it on to you.
Thank you so much for that, Shantae. I am happy to be a part of the Embrace Project. It is so important, and it's great that to have for me to be on the board and to actually be a voice for the children, because I went through foster care. I went through foster care at the age of 15, and I went through about 5 different homes in 1 year, which we all know is definitely detrimental, moving schools and things like that. But it's also crazy because when you're a youth at that age, you're trying to find yourself and figure out who you are culturally and going through puberty, all types of things like that. And moving through those many homes really impacted my life. The first home that I was in, uh, the first couple of homes that I was in were white homes, and they were really nice. I mean, the families were really nice to me. And I can't really speak bad, especially of the first home. I did not want to leave the first home. It was really great. I didn't really understand the importance of being with a family that experienced my culture, that knew about the things that I was going through as a young Black child until I got to a Black family, which doesn't always happen immediately that way because there's not always families available to foster you. And so once one was available to foster me, and my caseworker knew that that's probably what I needed, seeing, some of the things that I went through in my other homes, um, I was moved to that home and really embraced, really embraced. And I learned so many things about myself that I did not know. And sometimes I always tell people that that are about to foster or want to foster that sometimes you may think that something is wrong with the child, or why is the child acting this way? Why every time I come into the room, like for example, one of my foster homes, they were really nice foster home, but they were Jehovah's Witness. And one of the reasons why I went to foster care is because my mom was in a religious cult. And so even though they were really nice people, they didn't understand why I'm crying all the time, because it was a trigger for me. Even though they weren't forcing me to be in their religion, it was just a trigger being in a household of someone that was religious. And so being relatable to the child and knowing that the different things that the kid needs culturally is so important. And like I said, I lived that, knowing now that what I needed, but as a child, sometimes they're not able to voice that opinion. And I think that's why so important, why the Embrace Project is so important, and the studies showing that. Because again, as a young foster child, I did not know exactly what I needed. But once I was able to get into that home, and they knew a lots of things about me. They knew how to do my hair. They knew, a lot of things that I needed. And it really helped me to be more successful and to embrace myself as a young Black child in that home, and to be more successful when it came to schooling, when it came to even or joining extracurricular activities at school. I was more involved then when I felt more embraced. And so I keep using that word because I think it's so important when it comes to the project, but when it comes to how it can change a child's life when they feel like they're embraced. I mean, it can really spin a child that might be going down a spiral and turn their lives around when they feel like they are supported and embraced by the family that they're with.
Thank you, Erica. We appreciate you telling your story. It's not always easy to share, vulnerable details. And I think it's important too that you said that, right, even though the Embrace Project is focused on matching Black children with their culture, we want to think about how we can be culturally responsive to all children and what that means and what that can look like, and the practical application of that in different ways. Because as you mentioned, you have other ways that you were triggered that didn't have to do with being Black, right? So taking that into account as well. Um, Erica is going to have to hop off in a few minutes. If anybody has any questions, we're happy to take questions in the chat, um, or raise your hand. And if not, we'll move on to some of the research. Oh, I see one question from Mark.
Hi. I figure I'll just ask it as opposed to typing it. Thank you so much for participating and sharing. We really appreciate it. And this may be a hard question, or maybe even hard for me to ask. Imagine Embrace existed when you were a child. And just how do you see what we're doing here, how it would have impacted you in your childhood? And as being on the board, and we're going to hear what's up next, and we're going to hear the research results in a moment. So maybe my question's out of order a little bit in terms of chronologically, but just if you can think about where we're headed and what we're doing, and maybe describe how you think it might have impacted you as a child, and hence maybe children of today.
Well, I think that one of the things that was really important, and we found a lot in the research, is knowing why a lot of Black families don't foster or are not adopting children, and getting to those, getting that data and being able to use that data and say, you know what, let's start there. If the reason why a lot of Black families aren't fostering is because they've had some problems with the foster system, or they had one kid and the kid got taken away and that turned them off, and then they didn't want to foster anymore, which is some of the things that were found. And so if those things could have helped more Black families to have been able to say, you know what, there's someone that is saying, okay, and I hate to say the word targeting, but putting a light on us and trying to help us to be able to have more families that are Black and brown to foster, and that there would have been, so that would have made the result of having more Black and brown families that were fostering. We, in my county, they just didn't have it. It just wasn't there. And so I had to move to a whole nother city in order for them to find me a Black family, because it was just rare and far and few between. And I was class president at my school. I was class favorite at my school. And I had to leave my school in order to go to another county where there were more Black families, and that was devastating to me. You're going from excelling in school and being a great kid and having the support of your friends, at school, to now going blindly into a whole nother place where no one, which could have been prevented if there was a program like Embrace to target those people in that area, and say, you know what, I know these are the reasons why you don't really want to foster, but guess what? We're opening up those doors. You know what I mean? We're shedding light on that. We're helping to get more support for you all so that you all can foster, or the programs that they're going to be piloting when it comes to um, having mentors for foster families. So, for example, if that foster family, like we hear in some of the data, that foster family that was a foster child and then their kid got taken away, or the kid left and then they got turned off by that and they don't want to foster anymore, they had a mentor that say, look, that happened to me as a foster parent, right? Don't leave. Don't leave. There's another kid out there that's going to be good for you. And that could have been little Erica, and it could have changed my life, when I was a child, and my foster care experience, because maybe I would have been able to stay in my community, or where I was living, because there would have been more available to me. I hope that might have answered some of your question.
Yeah, especially I'll say on the outcomes side of the equation, right? In terms of providing for better outcomes for kids once they're I'll say in the system, right?
Yeah.
More addressing, I'll say the demand side for families, if you will, culturally relevant families, versus the supply side. I mean, in terms of helping to prevent the imbalance of the ratio of Black kids in foster care versus as a percentage of the population.
Okay.
Yeah.
Yeah, what you've highlighted for me is that there's you have to choose, right? There's a trade-off between, okay, do I stay stable, or do I go to be with my community, right? And those are two huge things to have to choose from. We can take one more question. if there is one.
I don't have a question. I just wanted to thank Erica for sharing your story consistently and being such an advocate for children. We really appreciate that at Embrace. And I just want you to see the messages in the chat where everyone is just thanking you and appreciating you for continuing to elevate your story. We really need it. Thank you.
Thank you so much. Thank you. And I appreciate the project. You know, there's a lot of different projects out there for all different types of organizations and cancer research and all types. I mean, and not saying that, you know, that's great that they have those, but it's not a lot of programs that are doing research for foster care, and it's needed. So I'm excited and happy to be a part.
Well, thank you, Erica. Thanks for joining us today. And we are going to move on to the research. Give me 1 second. Okay, so we talked a little bit about, making data available for everybody, taking it back to your places of organization, and how data can make real change through, sharing with networks, sharing with the legislators. We have it up and available on embrace.kidsave.org. We have a new research page there. So we have all this data that you're going to hear about today in full and downloadable. And so we have been working on family stories, specifically qualitative research from 50 Black adults from the Kidsave Gallup study and 4 sub-analyses reports. And so we're going into the qualitative analysis. We had qualitative interviews conducted in Los Angeles and Houston. 60 Black adults were interviewed about their experience with the foster care system and with foster care, with adoption, and with mentoring, as well as the role they feel racism plays in the child welfare system. So we have our Chloe and Nooper Desai were our research experts on our team, and Chloe is going to talk more about the qualitative.
Hi, everyone. Thank you so much for joining us. My name is Chloe Fuller. I'm the Assistant Manager of Communications and Research, and as Shantae said, I conducted the following research that we are going to talk about with an immense amount of help from Nupur Desai. And then also Mark Green's son, Joseph, was really helpful for us as well when we got into the secondary analysis portion, which we'll talk about in just a second. So first, we're going to talk about the qualitative analysis. So like Shantae mentioned, we conducted interviews of Black adults in Los Angeles and Houston. We used, just for my research nerds, we used the Braun and Clark method of reflexive thematic analysis. And in accordance with that, we divided the respondents up into 4 categories. We anchored those categories in proximity to foster care because our theory was that your proximity to foster care really shapes your perception and your opinion of foster care. So that was the hypothesis we were testing by grouping by proximity. So the groups were lived experience, secondary experience, tertiary, and no experience. And what that means is lived experience are individuals with direct experience in the foster care system, either as children in foster care, foster parents, or parents who lost their children to foster care. Secondary experience is 1 degree of separation. So that's someone with close family or friends involved in foster care, or people who were involved in the foster care system as foster adoptive parents. So not necessarily in the system themselves, but participated as parents. Or children whose parents provided foster care, so they had foster siblings. And then tertiary experience is that additional degree of separation, maybe a neighbor, maybe someone they work with, or someone that they know but are not close friends or family with, was involved in child welfare. And then we also included individuals with professional experience within child welfare in that group of tertiary. And then no experience were individuals who said that they had no direct connection to foster care and child welfare at all. And so I'm going to go through a couple of the key findings. This first set has to do with similarities across the groups. And so across all 4 groups, the majority of respondents said that, yes, they believe racism plays a role in foster care. across those responses, there was some variance of how severely it plays a role, but it was an overwhelming agreement that racism does play a part in foster care. 3 of the 4 groups had negative perceptions of foster care. That would be the lived experience group, the tertiary experience group, and the no experience group. The secondary experience group did have a positive perception of foster care, but it was only by a 5% margin, so it was very close. But all 4 groups had positive perceptions of adoption. And then the majority of respondents across all 4 groups also had positive perceptions about mentoring programs for youth in foster care and how they can positively impact not only the children participating, but also the adults participating in those programs. And then these key findings have to do with some of those, the ways that the groups responded differently. So those closest to the system, that would be the lived experience group particularly, and the secondary experience group emphasized the need for more mental health support. And then those groups that were farther away from the system emphasized a greater need for education and awareness programs. And what we can infer from that is that those groups that are more closely involved with the child welfare system are more aware of the mental health strain that it places on both the children and the adults involved, whereas those groups that are farther removed may not be as aware. And so that's why they need more resources around education and awareness about the opportunities that are available to them and the resources. Another thing that the lived experience where they differed was when asked about major barriers, they emphasized the complexity of the foster and adoptive process would be a major barrier for them. Whereas the other groups, if the process was mentioned, it was not highlighted as intensely as it was in the lived experience group. There were other barriers that were more top of mind for those groups. And then lastly, those without a strong connection to foster care, those in the tertiary and no experience groups, reported that they get their information primarily from television news and newspapers, whereas those with lived and secondary experience responded saying that they get their information about foster care and adoption from a first or second-hand account. One of the respondents, actually, a 60-year-old from Los Angeles who was in the tertiary experience group, when asked where she gets her information about foster care and adoption, she said, I watch a lot of police melodramas, and a lot of those deal with the bad side of foster care and adoption for the dramatic effect. And so that is what she reported as her source material for foster care and adoption. And so, again, that goes to speak to the need for education and awareness campaigns.
Thanks, Chloe. So we're going to just highlight, well, I'm going to read off a qualitative quote from one person who explained what role they think racism plays in foster care. And again, if you want to see much more in-depth analysis, we have more on the website because we have a lot of really great quotes, like firsthand from people who have different proximities to foster care. So Patrick says, there is no decision we make in our country that's not attached to race and ethnicity and socioeconomics. Take an African-American child in particular. Race always weighs into it because of the stigma attached to it, the unknown, the innate fear, because we're the other. And so what am I going to do? How am I going to explain it? How am I going to do their hair? What are other kids going to say? What are other moms going to say if they see me? Those kinds of things are 100% attached to it. And so Patrick is talking about, and he's from the lived experience group as a person who was very, very close to the foster care system. And so I think that this is really interesting because it shows the complexity of what a potential mentor or adoptive parent may have to think about when relating to a foster child and when out in the world, right? What are the barriers that people are considering when adopting and mentoring, and how can we address those barriers in our programming as well as in our stories? So in terms of the qualitative recommendations based on, mentoring, based on mental health needs and support, based on resources, and based on, the role that racism can play, we ascertained that we would like to recommend to connect both the family and the child, the Black family and Black child, with peer-to-peer support, mentoring groups, and local community resources. So coming from a strengths-based perspective, whereas many, Black and Brown children are already working within their community. How can we formalize this and engage in peer mentoring support within Embrace, and recommending that for anybody who's working with Black children in the foster care system. And then, so that would be in terms of connecting Black children with Black families. But we're also thinking about, if there are other families who want to mentor, support, we want to create culturally responsive support systems for anybody wanting to mentor or adopt a Black or Brown child, and youth of color, right? That way we're doing more help than harm, and still creating stable homes for children that are culturally responsive and permanent support, similar to what Erica was talking about earlier. And then last but not least, providing ongoing culturally responsive, trauma-focused mental health support. And so you'll see some of these come up as themes throughout all our analyses and all our research across all the different respondents and people who we interviewed. But specifically, when we're thinking about how do we support Black families and Black communities, these were our recommendations for creating strong, stable support systems within the community that can have an ongoing, positive, lasting effect for Black children to thrive. So moving on to our secondary analyses, we wanted to focus on populations, subpopulations that we specifically served, and hear what might be specific to these populations and the key findings. So we're going to pull out one or two key findings from each of these populations that were specific. And then we'll also talk about like the overarching themes as well that we saw. Right now, we're going to talk about LGBT group.
Thanks, Shantae. So like Shantae mentioned, this is a secondary analysis from our quantitative study where we gave a survey to 1,500 people. And so then we went through and pulled out subsects of populations that we were interested in analyzing. And so the first one was the LGBT community. The reason we focused on the LGBT community is because, like Black youth, LGBTQ plus youth are overrepresented in foster care, particularly in sub areas like, or big cities like Los Angeles, New York, areas like that have very large foster care systems as well. You can see our stat that we have about Los Angeles, about having 20% of youth in foster care, ages 12 to 21, identifying as LGBTQ plus, which is nearly twice that of youth estimated to be living outside of foster care. Also, LGBTQ plus couples are extremely active in adoption, particularly adoption from foster care. There are studies that suggest that same-sex couples are at least 7 times more likely to adopt than heterosexual couples, while other studies suggest that the rate may even be higher than 7 times. And then, yeah, like I said, over 30% of youth in foster care nationally self-identify as a member of the LGBT community. So this is a secondary analysis of the 567 respondents who self-identified as lesbian, gay, bisexual, or trans when completing the quantitative survey. So first, looking at one of the key findings from the secondary analysis has to do with a question that was posed saying, what would make you more likely to consider adopting through foster care? And while other groups said that having the support of the biological family would make them more likely to adopt, it was the highest among LGBT respondents. So this may be one reason why many LGBT adults choose to adopt privately or have children via a surrogate, because it gives them that reassurance that the biological families are supportive of the adoption. They also highlighted the need for having adequate training and resources when going into foster care and adoption. So again, that goes to kind of fears around the complexity of the process or fearing that they may not be adequately trained in order to provide foster care or adopt a child from foster care.
So our recommendations based on this secondary analysis is that increased training could encourage the 69% of the LGBT adults that were considering adoption to actually adopt. And so what kind of training might that be? That could be trauma-focused training, DEIB training that looks at representation and training on sexual and gender orientation. So Embrace is considering, based on these recommendations, how can we expand our representation and to focus on all marginalized communities served. Other training that's possible is eligibility campaigns and marketing, and as well as hiring LGBTQ plus staff that will increase representation as well. More awareness and education would be helpful for LGBT adults to be more involved in these processes, as 64% don't even know if they're eligible. So just doing very clear-cut campaigns on like, are you eligible? Yes, and this is why. As well as providing open and welcoming spaces, such as what I mentioned earlier, hiring more staff that represents the population served. So next is we did a secondary analysis of the Hispanic population based from our quantitative Kidsave Gallup study. And why are we focusing on the Hispanic population? Well, we focused on Hispanic or Latino children because they are the second largest group in the United States, making up 26% of the total child population. And they're also the second largest population group in the foster care system, making up 22% of the total children and youth in care. And so we wanted to make sure that we were representative of this group as well. And you'll see Cesar is one of our Kidsave youth here in LA that's looking for a adoptive family. So a key takeaway from the Hispanic secondary analysis is a barrier that many Hispanic respondents agreed upon was that the possibility the child will have behavioral or emotional challenges. 48.1% of our respondents were hesitant to mentor or adopt because of this barrier. And that speaks to kind of like a larger barrier, which was looking at the not being prepared enough, not feeling prepared enough, or looking at like, well, what happens? There's so much unknown, right? There's so much unknown for a child that may come into my home. And so our recommendations around that also include more training, that they may feel more prepared for what's to come. And preparation for engaging with the child, providing tools and strategies for the families. Also, again, more awareness and education on the processes of foster care, as well as resources and programs that could help Hispanic individuals better navigate the system. Having training in the language of origin could be helpful to reduce the barriers and increase a welcoming space, explaining the steps involved in foster care and reducing whatever overwhelm might be coming up for individuals where there's barriers to feel safe and prepared. And again, eligibility campaigns and having people that represent and look like them and speak their language to say, yes, you belong here, right? So we, for the sake of time, put together we have two different secondary analyses based on geography, one in Texas and one in California. And Chloe's going to talk about why did we focus on these two locations.
Yeah, like Shantae said, these reports were completed independently of one another, but there were some similarities in the findings, and then also for the sake of time, we're going to present them together. We chose California and Texas because they both have large child welfare systems. They both are systems in which Black youth and youth of color are disproportionately represented, particularly in the subgroup of youth in foster care that are waiting to be adopted. So, of the 15,000 youth in California that are waiting to be adopted, there is a high proportion of them that are youth of color. And then also even more narrow than that, Los Angeles in particular, which is kind of Kidsafe's home base, has a very large child welfare system with over 13,000 children in foster care. And because in LA County, Black youth only make up about 7% of the child population, but make up 25% of the youth in foster care. So that's a big disproportionality. And then with Texas, Texas also has a really large child welfare system, but also Texas has historically struggled to have an adequate number of foster homes for their youth in foster care and have struggled to find adequate housing for them. That's been an ongoing issue over the last several years. And then same thing, the Black youth and youth in color are overrepresented in the state of Texas. Black youth only make up 12% of the child population in Texas, but make up 22% of the youth in foster care. So this looks at some of the key findings between California and Texas. This one is a similarity. In both states, the majority of respondents said that they believe the foster care system could do more to help families stay together. That was 55% of Texan respondents and 64% of California respondents. So this goes to a need for better prevention services, or a perception that there needs to be better prevention services in both states. And then one area where the two states differed from one another comes in by the barriers to adopting from foster care. One of the unique barriers that appeared in the Texas analysis, you'll see at that number 3 spot, the possibility the biological parents would be able to reclaim the child if the child was living with me. This was unique to the state of Texas. And as far as our state analysis goes, that did not appear in the California response. The possibility the child was removed from the home for the wrong reasons did appear in both and appeared consistently across all of our secondary analysis, but the fear of that biological parents would be able to reclaim the child was a major barrier for Texan respondents. And so that speaks to a need for additional education or awareness about how the process works, maybe additional preparation for foster parents going into it if they are not fostering to adopt, of saying, that reunification is ultimately the goal of foster care, and things like that to help people feel more prepared and better understand what they're engaging in.
So our recommendations based on the Texas and California secondary analyses is to make resources more accessible, providing affordable and accessible, culturally responsive mental health care and tools and strategies. Providing relationship-based programs to minimize the feeling of not knowing a child and continuing to build the bond, getting to know a child slowly. And again, more awareness campaigns of the way that the foster care system works and how to be prepared for any unknowns that may pop up in the best way possible. So based on the research that was conducted by the Kidsave Gallup study, based on the qualitative and the 4 secondary analyses, and the overarching themes that we saw from all of that research and the stories and interviews that we've conducted on our own over the past year, Embrace is focused on some exciting things. I think things that will help improve some of our child welfare processes. So we are implementing a culturally responsive training within Kidsave first and foremost for all our new families. And this looks at well, I'll explain a bit more in a second. In Q1 of in Q1 of 2025, we're going to be implementing a peer mentor pilot. And then we'll be having more family stories and children's stories like the one you heard from Erica up on our socials, as well as in the media, so that we can raise more awareness from a firsthand lived experience perspective of like what actually, how this, how cultural connections, how could be helpful for children, right? How it can be improve outcomes, improve well-being, and help children to thrive ultimately. And so that would be focused on marginalized children and all of the subsections, people groups essentially that you heard about today. So we are actually launching a culturally responsive training within Kidsave for all our new families tonight. Our first session will be for all our LA families, and Kanisha Kuhn, who has a background in DEIB as well as lived experience, will be doing the training. And the point of the training is to, we'll be talking about the role that systemic racism has played in child welfare, to focus on, supporting effective cultural connections. And that would be for all children that are in our program and all families that come in, as well as developing practical solutions for, what that can look like, how it can go anywhere from a low lift of like, hey, let's watch a movie together and talk about it, right? What does your, let's listen to music that you like that's from your culture. And talk about that, to like attending festivals or finding Black doctors that may match, with your child, or having uncomfortable conversations with children, right? And doing your own reading and work around what that looks like, so that parents and adoptive parents and mentors and hosts are able to engage in their own role in, what it means to be practice cultural humility and cultural responsiveness, no matter what child that they organically might match with. And that'll be a 2-hour training every other month for our families as a basic introduction to cultural responsiveness. And as an ongoing support for families, or for adults, excuse me, that are interested in mentoring and hosting, Kidsave will be conducting a peer mentoring pilot. And this will match our new families who want to mentor or adopt Black or Brown children with families that already have mentored and adopted Black or Brown children. And they'll meet once a week, and they'll talk about strategies for cultural responsiveness, strategies for trauma-informed, engagement with the child. If barriers come up for the host adult, what that can look like, to practice your own self-care, so that you can be more present and supportive for a child that has dealt with instability, and racism, right, in more than one way. And so, and the peer mentors that we'll be hiring will also be trained by a clinician, so that they can have somebody that they has mental health background and licensure, so that it's coming from a strength-based perspective that's informed, and engaged with whatever comes up for the peer mentors as well, right? Because having lived experience is one thing, and then having training that's from a clinician, putting those two together will help create more success in the pilot. And we'll also be working with an external evaluation team to see, is this working? What's not working? How can we track the success of this pilot over the course of a whole year? And and then we'll be rolling out what worked, what didn't work in a year, and sharing that with the public as well, and hopefully creating a model that we can share, to improve outcomes for Black and Brown youth in foster care. So we're gonna stop talking now. We have about 8 more minutes and see if there's any, I'm gonna stop sharing, if there's any questions or conversation that people have.
I'd like to pop in before, oh, sorry, Mark, I beat you. My name's Kim. I'm the Director of Marketing and Communications for Kidsave, and I want to welcome all of you who joined us who I haven't met before. And I wanted to recognize Melinda's post about the Ad Council. PSA is coming out next week. We at Kidsave love the Ad Council and Adopt US Kids campaigns, and we lift them up as a model, and they're so effective and wonderful. And that's, working together, all of the people here and all of the people that we've met over the last year, that's the idea, right? Spreading the word. And so I just want to thank you for being here and really look forward to fostering the connections within this group so that we can create a bigger impact nationwide. Thank you. That's all.
Thanks, Kim. Mark, you have a question?
Yeah, I think more of a comment than a question as well. And so just a great big thank you, really. Amazing work. It's very informative, thoughtful, inspiring also to see the recommendations and what we're going to do next. And so I just very much appreciate your the work you're doing and sharing it with us today. And so if there's any way I can help in the future, please let me know. And I think we talked about this before, Shantae. I still feel like there's a way to do the Next to Get program that one of my prior colleagues in Los Angeles to connect up with the Embrace in some way. Even if it's not peer-to-peer, family to family, but there's a lot of mentoring of kids going on. And Larry's now moved into doing that full time and moved out of his IT career into doing this work full time now. And so anyway, just a thought that come across to me is I'm not exactly sure where the fit is because there's definitely, I'll say, a common purpose in some respects. More his is more focused on the kids per se, where here what we're focusing in this moment is on certainly on the kids, but on the families to help the kids, right? In terms of that side of the equation. So just it's a feeling as opposed to a thought.
Well, I think that's important because Larry, so Next to Get program that Mark's mentioning is a mentoring program for teens, I believe, and particularly like Black youth and Black boys.
Yes.
And we've worked together to do, we did an Instagram Live. I don't know if he told you, but we did an Instagram Live with another connection that we had a few months ago. And, there's so much overlap in terms of mentoring and there's a lot, I think it's like, how do we create, one thing Embrace has been thinking about is how do we create like a mentoring national database for foster, to find for foster youth, because mentoring is a great opportunity for adults who maybe aren't ready or don't have the capacity or don't have a home for an adopted child, but can provide still some source of like stability, right? And a connection and guidance for children. And but a lot of people, like even according to the study, like didn't even know that mentoring programs for foster youth existed. And so how can we kind of create a database around like mentoring programs that exist nationwide for foster youth would be amazing.
Yeah.
So if you have any, I think what we're really looking for around that at this point would be funding, and the opportunity to then advertise around that so that we can get the word out around like, yes, you're eligible to mentor and here's where you can do it, right? And so that's like kind of gets my wheels turning in that space. And I also want to recognize, thank you for, Melinda at Adopt US Kids for for referencing the work that we're doing. It's encouraging to be around community who like, uses each other's resources and knowing that like, okay, this is going towards something good. I've had people contact me and be like, we found your resource on the Embrace website and we used it for curriculum, right? And it's like, yay, good. I'm glad something is working, right? So we also are we're big fans of one another. Any 2 more minutes? Any more questions or comments? If not, I'll just say again, thank you for everybody for attending. Please check out the research and the website on embrace.kidsave.org. And if you want to sign up or refer people to be a mentor or an adoptive parent, you can also do that on kidsave.org. And we will definitely be in touch with everybody about our ongoing process. Have a great day.
Thank you
Great
so much.
job.
Appreciate it. Thank you,
Bye.
everybody.
Thank you.